The pandemic, the coronavirus pandemic really had me, going through the motions.
Yeah, in COVID, I faced a lot of challenges. One of them was being alone.
Like stuck. And I swear there were moments where I started doubting why I even decided to be a writer. I'm like, okay, what am I even doing?
I called friends 24 hours a day and it was not working. Until I decided to ride and go and see my friends, where I stayed for the last month of COVID.
Hi everyone, my name is Phillip Ayazika. I'm a program manager at Policy Uganda. Policy Uganda is a civic tech organization, and our mandate is to redesign service delivery. We function at the intersection of data, design, and technology. We are working on a project called Data Artistry for Mental Health. In this project, we are using data and art to empower creatives, learn about their mental health and their well-being. And from the start of the project, we have been engaging creatives from both Kampala and Jinja. And the main question is, why are we working with creatives and why mental health? So as an organization policy, most of our interventions involve using art. And so we work closely with creatives. And over time, and even during COVID, we noticed that at least the small community of creatives that we were working with over time were struggling because, as you know, the creative sector in Uganda isn't well streamlined, and most creatives, I think the biggest percentage of creatives don't have stable income. So because of the lockdown, one of the most affected sectors was the creative sector. And as we speak, up to now, the creative sector is still closed. So because creatives didn't have any incomes, any funds coming in, they've been battling a lot of things which has impacted on their mental health, from fear, depression, anxiety, all these things. And of course, most of them have found different means on how to handle this situation. But also, most importantly, is that for a country like Uganda, where we have less than 100 psychiatrists in the country, serving a population of over 42 million people, you can only imagine what and how the sector, the mental health sector looks like. When you look at people that are seeking out private sessions to get mental health support, on average, a session on mental health or therapy costs about $100, which is not something that most people can afford. Begin with creatives who have already said don't really have stable sources of income. So what this project is doing is, one, we are empowering creatives to learn about mental health, but most importantly, we are supporting them to put in place structures, social support systems that are going to help them handle mental health issues. So we're working with communities like Vodo Art Society, working with communities like the Innovation Village, and many more. So what we are doing within this project is we are going to train creatives in, of course, using various creative ways to raise awareness on mental health. One, we are going to make sure we instill, or in these communities, we are going to install mental health champions that are going to be able to handle mental health challenges as they come in, but also create a referral system around them that can support them if in a case that a community gets to have someone who has a serious mental health issue, they should be in position to, first of all, provide first aid support, but also moving forward to be able to do a referral, and preferably at a cheaper cost or reduced cost. So what we have done, we've worked with several mental health experts that have helped us put in place structures that can support creatives respond to mental health. And what we are doing is that at the beginning of the project, we did research, and the research was to mainly understand creatives' perception on mental health, but also to understand how did the COVID-19 situation affect creatives. And we've been able to understand a lot of things. And after that, we are doing a co-creation session where we want to understand, so this is a problem that we've understood from the data. Like I told you, policy is big on data. So from the data, what can creatives do about the outcomes? So most creatives have been saying they don't have support, they don't know where to go to. And for them, their closest source of support, or their closest support system, is their friends. So I want to say, how do we empower the creatives as friends, as workmates, as colleagues, to be able to provide each other with mental health support as we move forward? And so we are going to create lots of material from from songs to audiovisual content to murals, to create awareness on mental health among creatives. But most importantly, like I've said, train them on mental health themselves. And after that, there's lots of content that is going to be created in line with mental health. And we hope to hold an exhibition at the end of the project to just exhibit what has come out of the project, but also open a conversation on mental health, and also call on various stakeholders to pay attention to mental health, but most importantly, call on the creatives themselves to pay attention to their mental health, because it is important. Because we believe as creatives that use their minds to create, I think it's important that they have their mental health in check. Thank you so much.
Thank you.